Kidney disease is an expensive and time-taking treatment. Till now, patients suffering from renal disease had to seek treatment outside Manipur if they require kidney transplant. Now, to ease the burden on patients, Regional Institute of Medical Sciences will soon have a kidney transplant facility.
So in our state, we have both the facilities for doing hemodialysis and peritoneal dialysis. Unfortunately, transplantation is not yet started in the state, but very soon, I hope this facility also will be available to the patients of Manipur.
Kidney disease, if not treated on time, can lead to death. The treatment cost is also very expensive. This patient from Chuchampur is suffering from renal failure since 2012. According to his family members, till now, they have spent more than 3 lakhs on his treatment. They want some monetary help from the government to ease the financial burden.
Howdy Lagani Chang Loikriko, Ado Ahum Zogadore, Ado Ehoina, government P Ning Rebadi, Pang B Ning Rebadi ko, Paisa Pami, Paisa di, Hozik so Bakina, Paisa Tibanina ko, Zamna difficult oikre.
According to Dr. Nauram Sarachandra, every day 5 to 6 patients came to the hospital with kidney failure problem. He said over the past many years, the cases of renal failure have been increasing. With a new kidney facility coming soon at Regional Institute of Medical Sciences, patients will no longer have to travel outside the state for transplant, which will have to some extent save them from spending on treatment. With camera person Nangmayapam Bishojit, this is Gita Yanglem from RIMS Imphal.